to start with, thank you very much for what you've done as Shadow Chancellor over the last 5 years. You've been a great ally for our union, and you've been a great ally for disabled people as well. And I'm sure you will be carrying on that fight. So let me hand over to you now. Tell us about what you're doing, about relevant issues and stuff. And then if people want to ask John any questions, stick your hand up and we'll call you in after a bit.
Okay, let me just take you through where we're at in terms of the coronavirus outbreak and our negotiations with the government. The key issue that's come out of this is just how unprepared the government was for this epidemic. And it's interesting, Matt Rack, the General Secretary of the Fire Brigades Union, gave me a ring the week before last, and he reminded me that under the government's contingency planning, civil contingency planning, they do exercise every now and again. And there was an exercise back in 2016 called Cygnus, and it was based upon what they then thought would be the number one risk. And the number one risk then was a flu pandemic. But he said basically what came out of that, and what everyone now knows, is just how unprepared the government was, and that if you've got austerity measures for 10 years, effectively cutting back on your public services, particularly health, social care, emergency services generally, of course you're not going to be prepared for when a crisis like this occurs. And that's exactly what's happened. If you remember, on the figures around the NHS, 50,000 nurse vacancies before the crisis, they'd cut 17,000 beds, and in social care the figure was about 1.25 million not getting the social care they needed, but also over 125,000 vacancies in the social care sector. So they were ill prepared for any crisis like this. Then if you trail through the last few weeks, they came up with this strategy which completely contrary to what was being employed elsewhere or by the World Health Organization's recommendations. They came up with this idea that they'd allow the virus to go throughout society and would build up this herd immunity. What was pointed out to them was that actually herd immunity, you usually get that by vaccination, not by allowing people to suffer from the condition. That's why there was such a lack of focus on testing. The World Health Organization has said test, 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 and track. And the government only now is waking up to that. Boris Johnson a couple of weeks ago promised us 250,000 tests a day by now, and now Matt Hancock has come out with this proposed 100,000 tests by the end of the month. But we're still not sure whether that's swab testing or whether it's actually antibody testing afterwards, where there's no guaranteed test at the moment. So I think they've been an absolute mess. What we've tried to do is get some form of constructive engagement with them. So making sure that wherever the NHS needs the money, they get it, although it's difficult making up for 10 years of cuts. Making sure there's staff support. We're trying to make sure that they do expand the testing now. And what we're saying is actually they need to give us a date upon which particularly NHS staff have got access to, all the NHS staff have got access to testing, but also social care workers as well. There's a real crisis that's developing in residential care homes, as well as for social care workers who are peripatetic, who move from house to house. And again, what we're finding is that there's little testing going on, so you can't track the condition. But in addition to that, little protective equipment, PPE, being provided to not just to the NHS workers, but also to other key workers like social carers and others. So I think we have to be careful about the tone we approach publicly. And we've been trying to say, well, we're all trying to work together on this, but I have to say huge mistakes have been made by the government in how they've planned this, addressing the overall outbreak of the virus itself. And they certainly haven't learnt any lessons from elsewhere. Just one final thing on that in terms of the medical and the health support and social care support. We've also been trying to say, and it's 5 weeks ago now, we put proposals to them about the need for an international coordination of this, both in terms of what's G20, you know, all the major countries coming together, and also through the United Nations, the World Health Organization, and to make sure that there's investment going in, because the big issue now is it might well be in certain Western European countries that there's a strategies being developed, as there were in China and Korea, but actually there are places like Africa now where the health services are not particularly well provided or developed, where this could be an absolute nightmare, a real disaster. So we're saying to them, you've got to establish an international leadership role in this, in making sure the countries in the developing world, in the global south, have actually got support. Finally, let me just run through the support for workers. And we were pushing the government, and literally 4 weeks ago, 4.5 weeks ago, I did a speech which we said to them there needed to be a proper assessment of all government departments, what resources they needed, and they should get those resources. But we also said that there should be support for individual workers who themselves are either going sick and self-isolated, and we made the point then that statutory sick pay, £94.25, was so low, no one can live off it. Matt Hancock has even accepted that. But we also said that if there is a process for workers going off on furlough, as described by the government, companies should be paying 100% wages, not the 80% that Sunak has put forward. And we said the government should be putting 80% up, but if the companies participate in that, they should be required to put the other 20% up. They introduced the scheme. They've not made it compulsory. What we're finding is large numbers of companies are not participating. Some companies are forcing people into work, particularly in the construction sites, which are really dangerous in terms of contagion of this condition. But in addition to that, a number of companies have taken, well, they're using the virus as an excuse to lay people off, not participate in the job retention scheme and sack people. So what you've seen is 950,000 people over the last fortnight apply for universal credit, many of those because they've lost their job. So we've said to the government there needs to be more monitoring, more enforcement about safety conditions at work. But in addition to that, there needs to be really a requirement on companies to participate in the scheme to protect people and their jobs for the future. We've also said to them that in terms of overall levels, sick pay should be at the real living wage, that they should increase benefit levels, JSA, ESA, and carers allowance. We said at least to £100, but our argument now is they should be thinking about bringing in a national earnings guarantee. And the Joseph Rowntree Trust figure for that is about £221 a week. So all of that we've put to them. They've shifted a bit, and we're going to keep the pressure on them. I've been doing telephone conferencing with Treasury and Cabinet Office civil servants to try and push them along a bit more. But out there, it's looking pretty bleak for large numbers of people who are either being forced to work and risk their health, or are not going to work, and as a result of that, are not getting a decent income. Finally, if there's any lessons that could come out of this, is once we get through this virus, we should be talking about it now, about the sort of society that we want, the sort of economy that we want. And the key aspect of the lessons for most people now is you need decent public services, properly funded, so they can respond to any challenge. That means a fair taxation system. But it's interesting, isn't it, that actually when it comes to the provision, for example, of railways or buses, etc., they're completely dependent now upon the state. Publicly owned and publicly managed is the only way forward for those particular services. And you'll see that, I think, opening up the debate. Why should we hand them back to the privateers once this crisis is over? Because they've proven that they're unable to sustain the level of service, not just in the periods of crisis, but also on a day-to-day basis as well in normal times. So I think there's lots of lessons to be learned about, I think, the future of our society on this. And we should, from the progressive left, we should be arguing that case as well, because the right wing will want to say we've got to pay for this crisis with another decade of austerity. And we saw some of them at the beginning of the week who were lobbying to prevent the increase in the minimum wage. So you can see their direction of travel. They'll want working people to pay for this crisis rather than making sure that we have a fair taxation system and that others contribute as well. I've done an article for The Guardian today that's going up at lunchtime, and I've said if this crisis has to be paid for, it should be paid for by a windfall tax on the multinationals, a wealth tax on the rich and others as well, so that actually they pay their way this time, rather than that, as happened in the banking crisis when it was ordinary working people had to pay for it as a result of austerity being imposed for 10 years. So Janine, that's where we've got to on all of this. I stand down tomorrow as Shadow Chancellor. I'll be going up the back benches, but obviously what that does, it frees me up to get involved in a whole range of direct campaigning as well, and back on picket lines when they start again. And if there aren't physical picket lines, online picket lines, as we name and shame employers for their failure to actually support their workers in this campaign, as we've just done with McDonald's and Wetherspoons last night.